say thank you to some people in the industry that are part of this task force. That this is not the first time we do have a task force regarding healthcare. The very successful, and we got opportunity to extend Medicaid and Medicare services on the island. So I want to say thank you to Yvonne Rivera from the Centros de Salud Comunitaria 330, César Montijo Natal, presidente de la Asociación Primaria, Jaime Pla, presidente de la Asociación de Hospitales, Solange de Longré, presidenta de MAPA, Jorge Hess, presidente de la Asociación de IPAS, Edgardo Rosario, presidente de la Asociación Médica de Puerto Rico, Margaret Ramírez, presidenta de la Cámara de Comercio de Puerto Rico, Ricardo Hernández, presidente del Sistema de Salud Menonita, Felipe Cintrón, presidente de la Asociación de Laboratorios Clínicos, Isaías Serrano, presidente de la Asociación de Farmacias de la Comunidad, Rafael Vélez Rodríguez, presidente de la Asociación de Industriales, Luis Pizarro, Luigi, presidente de FIDE, Tania Conde, presidenta del Colegio de Administradores de Servicios de Salud de Puerto Rico, Jessica Loza Robles, presidenta del Colegio de Administradores de Servicios de Salud, Lilian Santos, presidenta de la Sociedad Americana del Cáncer, Roberto Pando, presidente del Comité de Salud Industriales, and our special guest, Asia Rivera from NGA, National Governors Association, that are here today. Huntley Campbell, Office of Congressman Gus Bilirakis. Bilirakis has been a great champion for Puerto Rico all his term in Congress. He helped us a lot, and I know he will do it again, so thank you for coming. And Joe Albanese from CMS, from which I just got a meeting before this opportunity here. Thank you for traveling to the island. So those are just a few of the people that are working with this issue. I do have a presentation for you guys. The health industry leaders, policymakers, advocates, providers, and researchers that are joining us today, I want to say thank you for your steadfast commitment and help to achieve the goal of having a good healthcare system on the island. Today I want to discuss where we stand, some of the work my administration is doing, and what is our request and our ask to Congress and the federal government as they continue to partner with us as we deliver quality health care to the 3.2 million Americans living on the island. I do have, perfect. Those are the facts that we're facing right now. Where we are, where we're looking, despite our strong performance in both quality and efficiency, we do have a problem, a structural problem. Where is the system on that? And let me begin with some context. Puerto Rico's healthcare system performs well and has consistently demonstrated strong results. And yet, it operates under structural constraints and budgetary limitations, not seen anywhere in the mainland under both Medicaid and Medicare. Over the past decade, and particularly during the first Trump administration, federal policy improvements have helped to stabilize our system. And I remember when Hurricane Irma and Maria happened, President Trump came to the island as well as his cabinet members, and they jumped our FMAP from 55% to 100% during those 2 years. Thanks to that, we have a better healthcare system on the island. Over the last decade, we have seen a subsequent increase in Medicaid funding allotments enhanced by federal Medicaid assistance percentage, or the FMAP, and administrative action in support of Medicare Advantage reimbursement rates for services offered on the island. But despite how incredibly helpful those actions were, they represent just temporary measures. They're not final. And all of us can attest temporary solutions do not equate sound and health policy. We need a long-term structural reform that provides certainty and sustainability to nearly half of the island's residents. And that's why I would love to work with you on where we stand. Esa es la razón principal por la que estamos aquí hoy. Tenemos un problema estructural de salud que está en una ley federal que nos da un pareo federal de 55% por ley. Gracias a los huracanes Irma y María, el silver lining de eso fue que el presidente Trump nos llevó a 100% de pareo por esos 2 años. Y de ahí a 86% porque teníamos el COVID. Pero ahora, si no se arregla la ley, volveríamos a un 55%, perdiendo casi 3.5 billones de dólares. Por eso estamos aquí hoy. So that's the reason I want to show you some things. Those are the beneficiaries of the assess during 2018 to the 2025. You will see who are they. And the Medicaid program covers 1.3 million Medicaid beneficiaries, or 47% of the population of the island. That's a lot. And because close of the 43% of our people live below the poverty level line, Medicaid is the key component to our entire health system. Our Medicaid enrollment rate is 26% higher than the US average, which places extraordinary pressure on program financing, provider participation, and our healthcare infrastructure. The program is administered by ACES through Plan Vital, que todos ustedes lo conocen, a managed care model, and Plan Platino, which serves our dual eligible beneficiaries enrolled in both Medicaid and Medicare. On this side, you'll find the number of Medicaid beneficiaries and a fair comparison with other states. You will see that the population covered by Puerto Rico, 47%, which is almost half of the island. When you compare to the rest of the states, no one is given more coverage than us. But you will see the poverty rate at the nationwide, again, 40% Puerto Rico, average 12% on the whole mainland, and Mississippi, which is the closest, still 18%. That presents a direct comparison of why we are so bad in these numbers. We cover 47% of our population. Mississippi, the poorest state, covered 23%, and Louisiana covers 30%. There is no other U.S. jurisdiction where Medicaid plays a more certain role than it does here on the island. And yet, by virtue of a limited funds law, we do more with significantly less resources. Let's quickly discuss the peoples behind those numbers, because people think it's just numbers. No, we're talking about our parents, our grandparents, our families, our neighbors. They're real people. And the population is aging on the island rapidly. The only age group that have grown since 2014 are our oldest residents. Unfortunately, our working age adults are leaving the island in growing numbers, and birth rates are declining, even when my husband and I try to improve that number by giving twins. So I encourage all of you, if you can still do it, bring more babies to the island. Right, honey? As that demographic shift continues, with the demand for intensive, complex, and costly healthcare services grows every year. On top of that, 60 to 70% of our population lives with at least one chronic condition. And in the case of Puerto Rico, we are talking about diabetes, we're talking about cancer, we're talking about heart diseases as well. And when we ask our people how they feel, nearly one in three describe their health as fair or poor, while the national average is almost 18. So these are not mere numbers or statistics. Those are our patients and our parents saying that they don't feel they're healthy. So across virtually every major chronic condition, Puerto Rico's rates exceeds the national average. 60 to 70% of the population has at least one of those chronic conditions, and you got the numbers there. So a larger share of individuals self-report their status as fair or poor, and that's something that we need to change. And that prevalence is happening always in the Caribbean, heart conditions higher than many other states. So the disparities in funding, and this is some of those conditions that we do have here on the island: arthritis, asthma, all the coronary diseases or myocardial infarction, they're higher than most of the states. Asthma, for an example, cardiovascular, diabetes, high cholesterol, hypertension. If you see the numbers and the percentage of individuals reporting that, those are facts. So the disparities in funding will get us to this one. The Medicaid funding, and this is the structural problem. If you ask me, this is the most important issue about today's discussion. Every state receives open-ended Medicaid funding, sin límites. Reciben presupuesto de salud sin límites. The federal match of the FMAP is calculated by a formula and ranges from 50% to 83% based on each state per capita income. There's no cap. There's no cliff. States can count on its funding as long as they have eligible beneficiaries. In the case of Puerto Rico, it's completely different. Under Section 1108G of the Social Security Act, our Medicaid funding is capped, and our FMAT is fixed at 55%. That's the law, and it's not being changed. Territories, on the other hand, have their FMAT fixed in law at 83%, not the case of Puerto Rico. So Puerto Rico, the territory with the highest poverty rate and the highest Medicaid dependency, gets just 55%. Congress has had to step in repeatedly to temporarily increase funding, especially following the hurricane and then the COVID-19. Yet, those interventions have provided limited fiscal stability that has always come with an expiration date. And that expiration date is going to be next year. And that's the reason we're gathering, we're meeting with the task force, trying to get the same data, to provide the same data to Congress and to the federal agencies. I remember when I was in Congress, during 2017, many of the senators and members of Congress told me, before you, the hospitals came and they gave us a number. After you, some physicians came, they gave us a different number. The government gave us a different number. So we better get our things together, and that's the reason we do have a task force, to literally rely on the same data so we can provide and not give any excuse to Congress or the federal administration on the numbers we're asking. I served since 2017 to 2024, and again, a united front was needed, as we don't have members of Congress with a vote in the House or members of the Senate. We need to be together on this, and that's the reason we are here today. That's the reason I want to say thank you for joining us, and I hope at the end of this presentation we can all sign an agreement to go to Congress and go to the federal administration as one voice, asking for what is needed for the island Medicaid and Medicare system. What is the consequence of the inadequate funding? This is the consequence. The consequences of capped funding are felt every day as we work to deliver quality healthcare services. Where capped allotment make it increasingly difficult to sustain program enhancements while also trying to close remaining eligibility to cover age gaps. When Puerto Ricans who need care cannot get it there, they leave. They go to Florida, they go to Texas. And when they arrive to the mainland, they are fully eligible for Medicaid under state programs where benefit spending per enrollee is higher and healthcare services are more expensive. And that's the reality. And it's more expensive for the federal government that actually giving us that money to do that service here on the island. The instability has a strong effect that is harder to quantify, but it's just real. Puerto Rico cannot engage in confident, long planning and strategic planning. Instead, what administrators, or hospitals, or providers, or health plans, they spend their energy running what-if scenarios, preparing for funding cuts that may or not realize. It creates confusion and instability in our system. A 2023 study found that 33% of people who moved from Puerto Rico to the mainland identified healthcare services as the main reason for leaving. That's 39%. And the rest say they moved to improve their quality of life. So this is a direct factor on why people are leaving the island. And how is the cost of that migration to the mainland. Underinvesting in Puerto Rico's Medicaid does not save the federal government money. Actually, in fact, it costs them more. In 2024, the estimated cost of Medicaid benefits for individuals who relocated from Puerto Rico was $165 million in the mainland. In total, federal cost of covering that same number of people in Puerto Rico would just be $44 million. That $121 million of difference in a single year. On a per beneficiary basis, providing health care to the mainland costs nearly 3.7 times more than providing that service here. We are advocating for the most cost-effective solution for Congress, and we are providing the data just to support that. Those are facts. Those are numbers. That's a reality. And that's the reason we need to manage the medical loss ratio as well. The financial stress on our system is also visible in how our health plans operate. Puerto Rico's medical loss ratio for Medicaid stands for 94% compared to the 91% nationally. For Medicare, we are at 89% compared to 90% nationally. A higher MLR means that there is almost no margin left for administrative improvement, workforce investment, or system enhancements. Inadequate funding puts our providers under greater financial pressure than their counterparts anywhere else in the mainland. It limits their ability to raise wages, recruit, and retain talent and invest in better care. And that's the reason we are losing our providers, our doctors, and physicians and nurses to many of the states. So those are the appropriations that are being approved in Congress. And you can see directly how it happened every year. Congress has recognized this problem and has acted. I personally made sure of it while I was serving as the sole member for Puerto Rico for 8 years. The most recent funding increase dates from 2022 and covers fiscal years 2023 until next year, with an annual allotment rising from $3.2 billion to $3.8 billion, plus $375 million provider payments that are tied to higher provider payments and integrity measures. And we can talk about integrity measures. Each of these interventions was meaningful. Each of them helped us expand services and improve programs and serve better our people. But fiscal year 2027 is around the corner, and that's the reason we're making this request. Those are the federal Medicaid matching appropriations. And you can see our law, by law, 55% under the Trump administration. Because of the hurricane, we went to 100%, 2 years, and then we went to 76%, and because of COVID, we went to 82%. But again, next year, we're gonna get back to 55% if nothing happens. The history of our FMAP tells us the same story. And that's the reason we need to not do a temporary fix, but a permanent exercise of fixing this. And those are the improvements and compliance we've been showing. Every dollar for additional federal funds that we have received has been properly put to work. We expanded coverage to include home health, durable medical equipment, hospice, non-emergency medical transportation, and expanded eligibility. We enhanced reimbursement to providers by establishing a Medicaid physician payment rates at 75% of the Medicare Part B rate, ensuring doctors are compensated fairly for the patients they serve. We designated a Medicare program integrity lead and a contracting and procurement oversight lead as well. And we implemented an asset verification system to protect against improper payments. We have built a responsible, accountable program. And I remember meeting with Senator Crapo at that time and many members of Congress when they imposed some requirements to manage fraud. No other jurisdiction, no other state got those requirements. And they imposed those 5 requirements to Puerto Rico to unlock more federal funds. So now we do have those fraud units that can be an example for other jurisdictions. And those are the measures. Our program integrity unit has strengthened its initiatives year after year by expanding staffing, enhancing procurement policies, and reinforcing governance at every key oversight point. The result? Puerto Rico's Medicaid improper payment rate in 2024 was 2.5%, compared to 5.09% nationwide. Our improper payment rate is 2 times lower than the US average. Those are results. This is functioning. That can be used in other states. But again, what are going to be the consequences of the cliff if we don't act? We're talking that we're going back to the 55% FMAT and $500 million. That would represent a drop in federal Medicaid funding of $3.5 billion, which, accounting for the full economic multiplier effect, translate to $5.4 billion in effect. And that means a total output loss for our island. An estimated of 700,000 to 1 million people could lose their health coverage. Our insure rate, which stands at 5.7% today, will jump to 30%. Maybe more than 48,000 jobs will be lost. And outmigration will accelerate, pushing more Puerto Ricans to the mainland, where, as I just demonstrated, the healthcare costs the federal government nearly 4 times more than doing it here. So this is the ask we do for Congress. We request specific and reasonable numbers based on the data. First, an allotment of $4.4 billion beginning in fiscal year 2028, with annual increase of 5% to maintain current coverage levels and keep pace with rising healthcare costs and our aging population. We're using the same numbers included in the Oversight Board fiscal plan. Second, an FMAT established under the same formula that apply to the states. Why the formula applying to Puerto Rico is less than the US Virgin Islands? We should have the same formula. Based on Puerto Rico's income and poverty levels, that formula will most likely yield a match of approximately 83% of the same rate currently received by other US territories. We're not asking for more than the formula will produce, and we're asking for the same calculation available under that formula. These 2 changes will provide the structural certainty our health system needs to plan, invest, and serve our people. They're the baseline of an equal treatment. But Medicaid is not the only federal health program where Puerto Rico faces structural inequity. Let me turn now to Medicare Advantage, which approximately serve in the island 775,000 people who are eligible for Medicare. Of those, 94% are enrolled in Medicare Advantage, the highest penetration rate in the whole nation. And of those, 306,000 of these beneficiaries are dual eligible, relying on both Medicaid and Medicare for the care. Puerto Rico is an example to the nation on how Medicare Advantage works and can deliver to their beneficiaries. Yet despite having the highest MA enrollment rate in the country, the MA payment rate on the island remain sustainably lower than those in the rest of the nation, including the US Virgin Islands. We have the sickest people, the oldest, the most complex Medicare population in the United States, and yet we receive some of the lowest payment rates. And that's the reason many of our providers are leaving the island. And on top of this, we are excluded from 3 major federal programs that support low-income healthcare beneficiaries everywhere else in the country. The Medicaid Savings Program, and we're pushing for that, the low-income subsidy or the extra help for Part D, the prescription drugs, and the disproportionate shared hospital payments that are needed on the island. Our seniors are paying more out of their pocket for medications. Our hospitals are absorbing uncompensated care costs that will be covered elsewhere, and that's the reason they're leaving. And then we go to the wage index. And I want to explain one specific mechanism that makes this inequity self-reinforcing, because it illustrates exactly how the current federal formula traps Puerto Rico in a cycle we cannot escape on our own. It's called the wage index. Medicare used wage index in its hospital payment formula to adjust reimbursements based on local labor costs. The logic is very straightforward. Pay more where labor costs are higher. It's not rocket science, right? But there is a problem with that. Because our hospitals have historically had lower wages, largely because Medicare payments were lower, or wage index is lower as well. And because our wage index is lower, Medicare calculates our hospital payments at a lower rate. And because our hospital payments are lower, our hospital cannot afford to raise wages, keeping wage index low. It's a trap. And it's a structural feedback loop. Low wages lead to a low wage index, which lead to a low Medicaid hospital payments, which limit hospitals' ability to raise wages to their employees, which keeps the wage index low. And this is not a Puerto Rican failure, this is a formula failure. And it does not reflect the true cost of delivering healthcare system with high disease prevalence, elevated poverty rates, and significant reliance on public insurance. We have some data here. The chart that on this slide shows exactly where Puerto Rico stands. If we compare the wage index values around 0.75% to 0.83 of the San Juan, Bayamón, Caguas area has been steadily declining from 0.41 in 2019 to just 0.34 cents in 2026. We are at 1/3 of the national benchmark and falling, and this is not a reflection of our healthcare worker skill or commitment. This is a mechanical output of a formula that must be improved to reflect the reality of care costs on the island. And this is what we're talking about. Those are the numbers. From 2019 to 2026, you can see the decline on those numbers. And if we don't fix the formula, it will continue to low, and you will see wages going up in the rest of the mainland, but not in Puerto Rico. Our first request to Medicare are equally specific. Those are going to be your requests. First, reform MA benchmark methodology so that payment rates reflect the true cost of caring for a population. We have proposed establishing a national minimum payment at a geographic adjustment factor of 0.70, using the current rate that U.S. Virgin Islands use as a baseline. Second, address the Medicare Part A inpatient prospective payments, wage index disparity that is suppressing hospital payments across Puerto Rico and the nation, and similarly, properly adjust the proxy factors for the supplement and security income. Now let me tell you what we've been doing with administration. Earlier this year, we signed the Executive Order 2026-0006, establishing the multi-sectoral working group to ensure fair and equal funding for federal health programs. This working group works together, as we explained at the beginning of this presentation, and they're actively engaging with Congress and federal agencies, evaluating applicable regulatory requirements and coordinating with my office to ensure we maintain a united strategic front. The united front with a single voice, just like we did in 2022. We need to increase the MA payments by 4%, and I need to here say something that I believe is very important. Puerto Rico's MA payment rates will increase for the first time in 2027 at 4%, exceeding the national average increase of 2.48%. This is historic. And it happened because our direct, sustained engagement with the President Trump administration and our allies in Washington. And I need to say thank you to the Trump administration for making this a reality. I want to say thank you to the people from CMS, to the people from the Health and Human Services for getting this done. Nobody was expecting almost a 4% increase. We were expecting the national media, it was an average of 2.48%, and we got the higher in the nation. So I want to say thank you to the administration of President Trump for allowing this reimbursement rate to Puerto Rico. Now, finalizing, I just want to say that while I was in Congress, we made this fight a priority, and now as a governor, we do the same fight as well as a priority. I want to say thank you to all people that are here. Quiero darle las gracias a todos los componentes que están en cada uno de los sectores, a las enfermeras, a los laboratorios, a las farmacias, a los técnicos, a los administradores de hospitales, a los hospitales, a cada una de las categorías que nos ayudan en el sector privado, a los industriales, a la Cámara de Comercio, a todos y cada uno de los grupos que han hecho también esto una prioridad. Si todos mejoramos nuestro sistema de salud en Puerto Rico, nos beneficiamos todos. No solamente de nuestros familiares, nuestros abuelos y nuestros viejos, sino toda la economía de Puerto Rico. Estamos hablando de más de 48.800 empleados directamente relacionados con esta industria, que de no lograr estos acuerdos de Medicaid podrían perder su trabajo. Estaríamos hablando de una reducción de más de 3.5 billones de dólares en la economía de Puerto Rico. Pero yo estoy confiada que el trabajo que vamos a estar haciendo en conjunto, los esfuerzos que ya estamos liderando con 2 reuniones físicas presenciales, pero múltiples reuniones de manera virtual, nos van a llevar a la meta. Yo creo que mucho mejor preparados que lo que estuvimos la última vez, y muy agradecida porque el presidente Trump ha designado a personal que conoce este tema. Ya hemos tenido múltiples reuniones, el secretario de Salud, el director de ACES, esta servidora, la directora de PRAFA, con el componente de CMS, Dr. Oz, y muchas de las personas. De hecho, hoy tenemos visitas aquí precisamente de esas oficinas para seguir trabajando de la mano y que tengamos la misma data, que es el elemento más importante. Solo así vamos a lograr asegurar el que tengamos nuevamente una proporción adecuada de la asignación federal para la salud en Puerto Rico. Dios los bendiga a todos, and let's do it together. God bless you.
Agradecemos a la honorable Jennifer González Colón, gobernadora. esos sectores de todo el ecosistema de la industria de la salud en Puerto Rico y se está firmando un acuerdo multisectorial que será una herramienta para llevar una voz unida, una sola voz ante el Foro Federal para cabildear a favor de la paridad en fondos federales para los servicios de salud en Puerto Rico. Ya la gobernadora hizo una presentación sobre por qué es necesario, porque ya el próximo año estaríamos acercándonos a lo que se conoce como el Medicaid Cliff, donde se regresaría a la fórmula de 55% de fondos para ese programa. Y obviamente se lleven este mensaje de unidad de propósitos para poder lograr que ciertamente no se reduzcan los fondos para el programa de Medicare y Medicaid en Puerto Rico. Y no hay duda de que cuando los puertorriqueños nos hemos unido para causas importantes, se han podido lograr grandes cambios, así que en esta ocasión también confiamos en el trabajo, los argumentos, las estadísticas, los datos que va a llevar este grupo multisectorial también cuando vayan a reunirse con las agencias gubernamentales a nivel federal y también cuando vayan al Congreso, porque ciertamente hará falta también algún tipo de legislación. Agradecemos enormemente al director de ACES, al licenciado Carlos Santiago, por la organización del evento y por también los temas tan puntuales que se han discutido, se han analizado en la mañana de hoy. Y en la tarde también hay dos paneles, uno sobre los trabajos en el Foro Federal. Ahí está la firma del acuerdo multisectorial.
Aprovecho para agradecerle a todos los miembros del comité, al comisionado residente que también está incluido en esta discusión, el que podamos poner a Puerto Rico primero, ¿verdad? Y que estos temas que fueron los mismos que, no voy a leer el acuerdo aquí, pero es lo mismo que hice en la presentación, las peticiones de específicamente lo que tiene que ver con el Seguro Social Suplementario, a nivel de proxy, lo que tiene que ver con el Disproportional Share Hospital, el Low Income Subsidy y el programa Medicare Savings Program, al igual que obviamente las partidas, ¿verdad?, generales, es básicamente el documento que lo vamos a hacer público para que todo el mundo, ¿verdad?, lo pueda ver. Así que enhorabuena y que siga la lucha por los fondos de Medicare en Puerto Rico.